be an art therapist in a mental health facility, Part 8. So if you've been following my videos, I'm kind of just covering things that may not come to mind when you start your job at a mental health facility or even just in art therapy in general. So this topic I wanted to bring up, but I kind of touched upon it the other day, which was about what supplies you absolutely cannot use in a mental health facility. The other side of that is supply and demand. It has to do with affordability and the budget of where you are working. So when I first started this job and I did implement the program for this mental health facility that I am working at, I came into a clean slate, like a blank canvas, which I was happy to do. So the supplies that they had on hand were really, really limited, very more artsy craftsy type stuff. But you know, being an art therapist, there's a lot more to it than just doing gluing and collage. So it's really, really important that you look at that list that I kind of put up there and also do your due diligence and look up materials that you cannot use with certain clientele, because this is super, super relevant when you are ordering your supplies and actually looking for activities to do based on that. So cutting corners, you can order from, a lot of places online, especially wholesale places are really handy, but also I found the dollar store is great. I'm able to spend money and be reimbursed through my company to do that. But being really resourceful and do your homework. So often I will peruse Instagram and look at what some of my favorite artists are doing, or even people just doing crafts. Then I like to dissect their art. So for example, mandalas. I love doing mandalas on a canvas. Okay, so canvases are quite expensive to use, and when you're doing 4 groups and probably, let's estimate, anywhere between 8 to 15 patients per group, that can get pretty costly. So you gotta be inventive. So I started using paper plates. Yep, those cheap paper plates. They come in, obviously different sizes, but I used to use, I believe it's like a 8-inch plate, just typical boring paper plate, no frills, okay? That's giving you your nice circle that you're going to use with your patients. And it's cheap, so what's even better than that? So with some of the designs, you like to do circles and circles and circles inside of it. And what I found was just supplies in the lunchroom in my company. I was able to grab a smaller, like dessert size paper plate. Actually was made of styrofoam. I grabbed styrofoam cups and also little medicine cups. So there are 3 different types of circles, and what I have my patients do is start with the smaller one in the center and then work their way out. So it's just simple tracing, because again, I'm trying to maintain this calm. I don't want anyone stressed out about having uneven circles, and this is the most uniform way to do it. In private practice, you are able to use many different things. Probably a compass would be available to use, and to me that's my personal favorite, is I love using a compass. But also where I'm working, that can be considered a weapon if you know that sharp point that I'm talking about. Plus you do use a pencil, and pencils are kind of outlawed where I work as well. So what I'm getting at is just be creative with what you want to do. Look at those cool projects that you see on Instagram and Facebook and dissect it and go, how can I bring that to my patients on a budget and within reason and safely? So it does take a little practice, but it's really cool, and you'd be amazed at what you come up with and thinking outside the box. And the patients rave about it, and I get a lot of feedback like, hey, I'm gonna do this when I get home because I know where to get the materials. So anyway, little tidbit for you. I'm Jean, and I'm an art therapist.